2 a.m. The house is quiet, but inside Arthur's mind, a siren is blaring. He just opened his routine blood work. Right there, highlighted in bold, PSA 6.2 ing per ml. Like clockwork, out comes the smartphone. He types PSA 6.2, and within seconds, he's drowning in the worst-case scenario. If you're watching this, you or someone you love might be in Arthur's shoes. I'm here to tell you, stop Googling.
If you have any questions.
A PSA of 6.2 is what we call a smoke alarm. It tells us there's smoke. It does not automatically mean there's a fire. To understand why, let's meet the source. This is the prostate gland. It's a small, walnut-sized organ that works hard every single day. Its main job is making seminal fluid. As it works, it naturally produces a protein called prostate-specific antigen, or PSA. Most of this PSA stays right where it's needed, but a tiny amount leaks into the bloodstream river running right next door. When you get a blood test, they're just measuring how many of these PSA puzzle pieces are floating in that river. Historically, doctors like to see this number under 4. If it's between 4 and 10, like Arthur's 6.2, you enter what urologists call the gray zone. This is where anxiety spikes. It sounds ominous. But here is the most important statistic you will hear today, according to Mayo Clinic guidelines.
The least invasive options first.
Roughly 70 to 75% of men with an elevated PSA in this gray zone do not have prostate cancer. Let that sink in. 3 out of 4 times, the alarm is tripped by something completely innocent. So if Arthur doesn't have cancer, why is his alarm blaring? To answer that, we have to understand what causes a false positive. Think of your kitchen smoke detector. It's designed to save your life if the house is burning down. It's incredibly sensitive. But what happens if you just burn a piece of toast? The alarm screams just as loud. It doesn't know the difference. Your prostate is exactly the same. It is a highly sensitive, reactive gland. It doesn't take a tumor to upset it. Let's go back to our hard-working friend, Mr. Walnut. He is easily irritated by everyday physical changes or simple mechanical stress. If he gets squeezed, bumped, or inflamed, he panics and drops a massive load of those blue PSA puzzle pieces into the bloodstream. Another crucial factor is simply the passage of time. According to the American Urological Association, your prostate naturally grows as you age. A 20-year-old prostate is the size of a small chestnut. By age 60, it might naturally be the size of a lemon. More prostate tissue naturally means more PSA production. A normal level for a man in his 60s is generally higher than someone younger. That's why a single test score of 6.2 is just a snapshot. It lacks context. It's a single frame of a movie. Urologists don't just look at one number. They look at the trend over time. This concept is known as PSA velocity. A slow, gentle upward slope over a decade is very different from a sudden, sharp spike that happens in just 6 months. Arthur realizes his doctor isn't rushing him to the operating table. She is looking at the bigger picture of his overall health. Before jumping to invasive procedures like a biopsy, we first have to rule out the burnt toast, the innocent culprits. There are 3 extremely common, completely harmless reasons why Mr. Walnut might be flooding your system with PSA right now. Culprit number 1 is BPH, or benign prostatic hyperplasia. It's a long medical term for a very simple concept: prostate enlargement. Remember how the gland naturally grows with age. Sometimes it grows just a little too fast, taking up too much space in the pelvis. As Mr. Walnut expands like a balloon, his internal pressure increases. This pressure alone forces extra PSA to leak into the bloodstream. And it's incredibly common. According to the National Institutes of Health, up to 50% of men have BPH by age 60. Arthur is 58. Statistically, it's a coin toss whether his high PSA is just a harmless sign of normal, non-cancerous growth. Culprit number 2 is prostatitis. This is inflammation or an infection of the prostate gland. It's like your prostate catching a bad cold. When inflamed, Mr. Walnut gets swollen, red, and highly irritated. His cellular walls become leaky, pouring massive amounts of PSA into the river. Prostatitis can push your PSA level extremely high, sometimes doubling it in a matter of weeks, creating panic when it's entirely treatable. Culprit number 3 is everyday mechanical stress. The prostate sits right beneath the bladder in a very busy, physically active neighborhood of the pelvis. Activities that put direct pressure on the groin, like long-distance cycling or even a routine digital rectal exam, can momentarily squash the gland. Sexual activity and ejaculation also cause the prostate muscles to contract forcefully, squeezing those blue PSA puzzle pieces right out into the blood. This is why I always tell my patients, absolutely no cycling and no sexual activity for at least 48 hours before a PSA test. Arthur realizes he rode his bike 10 miles the morning of his blood test. The alarm might have been triggered by his bicycle seat. BPH, inflammation, and physical stress. These 3 benign factors account for the vast majority of high PSA readings in the gray zone. But hope is not a strategy. We need to be absolutely certain it's just the bicycle or BPH. So what's our next move? In the old days, a PSA of 6.2 meant an immediate, uncomfortable prostate biopsy. But medicine has evolved. Instead of jumping straight to needles, doctors now look at secondary blood markers. The first is called the free PSA ratio. PSA travels in your blood in 2 ways, bound to other proteins or floating free. A higher percentage of free PSA is actually good news. Cancer cells tend to produce PSA that tightly binds to other proteins. So, if your free percentage is very low, the suspicion goes up. But perhaps the most powerful mathematical tool we have before an MRI is called PSA density. PSA density simply asks, is this gland producing an amount of PSA that makes sense for its physical size? If you have a large, lemon-sized prostate, naturally, it produces more PSA. The density is low. This is usually harmless BPH. But if you have a small, chestnut-sized prostate that is pumping out a massive amount of PSA, the density is high. That's suspicious. Arthur looks at his chart. His prostate volume is 50 cubic centimeters. His PSA is 6.2. The density is 0.12, while under the danger threshold of 0.15. By combining free PSA and PSA density, we filter out a huge percentage of the burnt toast false alarms. But what if the density is a little high, or the trend is spiking faster than we'd like? Do we biopsy then? No, we take a picture. Enter the Multiparametric MRI. This machine is the biggest game changer in modern urology. Unlike old ultrasounds that were practically blind, a multiparametric MRI looks at the tissue in multiple different ways, acting like a cinematic magnifying glass. It maps out the water content, the blood flow, and the cellular density of the gland, looking for anything that behaves like cancer. According to the New England Journal of Medicine, using MRI first can reduce unnecessary biopsies by up to 27%. That's thousands of men saved from a painful procedure. So, Arthur gets his MRI. A few days later, the report comes back. But instead of a simple yes or no, he gets a number. That number is called a PI-RADS score. It stands for Prostate Imaging Reporting and Data System. It sounds complicated, but think of it like a weather forecast. The score goes from 1 to 5. A PI-RADS 1 or 2 is clear skies. It means the MRI sees a completely normal prostate, or maybe just some benign BPH. If Arthur gets a 1 or 2, he can breathe easy. The chance of aggressive cancer is extremely low. The biopsy is canceled. He just needs monitoring. A PI-RADS 3 is an overcast day. It's equivocal. The radiologist sees a shadow, but they aren't sure if it's an old scar or a tiny tumor. This is where the art of medicine comes in. For a PI-RADS 3, we might look back at that PSA density. If it's low, we might just wait and retest. And then there's PI-RADS 4 and 5. This is the thunderstorm forecast. The MRI has spotted something that looks highly suspicious. If Arthur gets a 4 or a 5, that's when we biopsy. But because we have the MRI, we don't have to guess where to look anymore. We do what's called a targeted or fusion biopsy. We overlay the MRI map onto a live ultrasound, creating a GPS system for the prostate. This means the doctor can guide the needle directly into the storm cloud, reducing the number of samples needed and dramatically increasing accuracy. But let's face the fear. What if Arthur goes through all this, and the biopsy comes back positive? What if it is cancer? Even then, the narrative has changed. Prostate cancer is uniquely different from almost any other cancer in the human body. Most prostate cancers found in the gray zone are so slow-growing, so indolent, that they are often compared to turtles. They might never cause a problem in your lifetime. In fact, urologists have a saying: most men will die with prostate cancer rather than from it. Because of this, if we find a tiny, low-risk, turtle tumor, we don't rush to surgery or radiation. We enter a phase called active surveillance. Active surveillance is not doing nothing. It is not giving up. It is a highly structured, rigorous monitoring program. For Arthur, this means regular PSA checks every 6 months, an annual digital rectal exam, and periodic MRIs. He keeps his prostate and avoids the life-altering side effects of immediate surgery, like incontinence or erectile dysfunction. The data is staggering. Over a 15-year period, the survival rate for low-risk prostate cancer on active surveillance is nearly 99%. If the turtle wakes up and starts moving faster, we catch it, but often it never does. However, the biggest challenge of active surveillance isn't biological, it's psychological. Knowing that a tumor is sitting there, even a lazy one, can cause immense anxiety before every 6-month checkup. That's why a good urologist treats the mind as much as the prostate. You are not a ticking time bomb. You are a monitored patient. Instead of worrying, we focus on what you can control during surveillance: your metabolic health. Diet and exercise aren't just for your heart. High insulin levels and systemic inflammation act like fertilizer for all cells, including the lazy turtles. By eating a Mediterranean-style diet, losing excess weight, and staying active, Arthur isn't just waiting around. He's actively starving the turtle. And simultaneously, a healthier lifestyle reduces BPH symptoms and inflammation, quieting the false alarms for Mr. Walnut. So, when you see a number like 6.2 on a piece of paper, remember the journey we just took.
We have a clear path forward.
It's a smoke alarm, not a diagnosis. We have the tools, free PSA, density, and MRI, to figure out exactly what's burning, without putting you through unnecessary pain. Arthur puts the paper away. The siren in his head is finally quiet. He knows the next steps, and he's ready. But there's one more piece to the puzzle of the gray zone, and it's something you inherit long before you ever take a PSA test. Genetics. According to the Prostate Cancer Foundation, having a father or brother with prostate cancer more than doubles your own risk. Specifically, mutations in genes like BRCA1 and BRCA2, the same genes famous for breast cancer, can make prostate cancer much more aggressive. If a patient has a strong family history or a known mutation, a PSA of 6.2 isn't treated like a potential false alarm. It's treated like a siren. Arthur knows his dad lived to be 90 without a hint of cancer. That genetic safety net gave him and his doctor confidence to choose surveillance. But if the genetic dice roll differently, those slow-moving turtles can act more like cheetahs. They grow fast and spread quickly. In those cases, active surveillance is off the table. The conversation immediately shifts to decisive action, surgery, or radiation. These treatments are life-saving, but they come with heavy costs to a man's quality of life. That's why we fight so hard to avoid them unless absolutely necessary. Arthur's journey from panic to peace wasn't just luck. It was the result of a paradigm shift in modern urology. We no longer treat the number. We treat the man. We look at the size of the gland, the density, the MRI, and the genetics. It's an entire toolkit designed to protect your life without sacrificing how you live it. If you're staring at an elevated PSA right now, take a deep breath. Talk to your doctor about context. Ask about density. Ask about an MRI. Because more often than not, the alarm is just burnt toast, and you still have a lot of life left to live. Music swells to a peaceful, resolved conclusion. The information in this video is for educational purposes only and does not substitute professional medical advice. Always consult your doctor before making any health decisions. Before we go, let's talk action. If you're in the gray zone, there are specific, scientifically proven steps you can take today to protect your prostate. Step 1 is nutrition, specifically a powerful antioxidant called lycopene. And its best delivery system is the humble tomato. A massive study from Harvard University found that men who ate cooked tomatoes multiple times a week had a 28% lower risk of prostate cancer. Why cooked? Cooking breaks down the tomato's cell walls, allowing Mr. Walnut to absorb massive amounts of lycopene, shielding his cells from oxidative damage. Step 2. Don't fall for the supplement trap. You've probably seen ads for prostate health pills containing saw palmetto. According to a massive Cochrane database review, saw palmetto was no more effective than a placebo at treating prostate symptoms or lowering PSA. Some unregulated supplements can even artificially mask your PSA levels, effectively turning off the smoke alarm while a real fire might be starting. Step 3. Arm yourself with the right questions. The next time you see your urologist, don't just accept the number. Ask these 3 things. Number 1. Based on my prostate volume, what is my PSA density? This immediately tells your doctor you understand the context of the size. Number 2. Do you use a 3 Tesla multiparametric MRI? A 3T machine is the gold standard for clarity. Accept no substitutes. And number 3. Can we run a free PSA percentage before deciding on a biopsy? It's a simple blood test that can save you immense physical stress. Knowledge is the ultimate cure for anxiety. Your prostate is working hard for you. Treat it well, ask the right questions, and don't let a number rule your life. On behalf of Mr. Walnut and urologists everywhere, stay informed, stay healthy, and we'll see you in the next video. If this video brought you peace of mind, please share it with a friend who might be waiting on their own results. Subscribe for more health science. The information in this video is for educational purposes only and does not substitute professional medical advice. Always consult your doctor before making any health decisions.